There are a few risks which are uncommon, but it's important to talk about risks of facelift surgery. I would say the most common complication is a hematoma, which is a blood clot under the skin that may require a syringe to suck out the blood clot. It also may require creating an opening and sucking out the blood clot after the procedure. If it does occur, which is very rare, maybe 1 out of 100 facelifts, you may have a hematoma. If it does occur, you'd have to treat it within the first 24 hours. That's when it most commonly occurs. So it's important to recognize it, treat it. If it's recognized and treated expeditiously, then you will not have any prolonged effects from the hematoma. So hematoma is one possible complication. Infection, as in any surgery, you have to take precautions against infection. Diabetic patients or smokers have an increased risk of infection. There's also an infection called MRSA, methicillin-resistant staph aureus, which is more commonly occurring in hospitals. It rarely occurs outside the hospital setting. So if you're having surgery in an office setting, MRSA is less common. I typically give my patients an ointment to use in the nose called Bactroban, which decreases the area that contains MRSA in the facelift region. So my patients start using that 3 days prior to surgery. They put an ointment in the nose so that the area or the field where the facelift is being performed has less risk of infection. I also typically advise my patients to use Hibiclens shampoo the night before the surgery and the morning of the surgery. That also diminishes the risk of an infection. And we also give intravenous antibiotics half an hour prior to making the incision. All these measures also decrease the infection rate. I would say the infection rate is extremely low. If you're not diabetic, non-smoker, it is extremely low. But if treated, it should be recognized quickly and treated quickly in order not to cause a prolonged problem. And the third possible complication is a nerve injury, and that is extremely rare. And it has not happened in my practice, but it is reported in the literature. And that's important to inform the patient of possible risk of nerve injury, which is extremely uncommon. Sometimes, which is also very rare, you may get a nerve weakness from swelling or stretching, but that usually resolves within 3 months. And last but not least, there are other complications like hair loss, which is very uncommon if you select the proper incision, where you're not putting the incision all the way up into the temporal region and you're removing too much hair. So if you put the incision right at the hairline, you will prevent excessive hair loss. And those are the main complications after facelift surgery.